Welcome back to the Mid-Atlantic Sports Report. Phil Wood along with Mel Antonin and former Major League left-hander Mike Wallace. Recently, Seth Manis of the St. Louis Cardinals had surgery, and Derek Gould of the St. Louis Post-Dispatch wrote, "Why all of Major League Baseball should be studying Seth Manis' return from elbow surgery could signal an alternative to Tommy John surgery." Joining us on the telephone from the Andrews Sports Medicine Group is Dr. Jeff Dugas. Dr. Dugas, thanks for joining us today. And just in short, what's the difference between this surgery and the traditional Tommy John surgery?
Well, first, thanks for having me. This operation is a little different in that we're preserving the native ligament if the native ligament is preservable. So this is not an option for people with bad tissue that's degenerative over time. We're taking a good piece of tissue that tore and repairing it and then augmenting it with what's called an internal brace, which is a two small anchors spanned by a biologically enhanced tape, which is made of a very strong suture material and then coated with a bovine collagen. So it's an alternative, but it's only an alternative for people that don't have what we call a tissue deficiency. If they've got good tissue that tore, this is a good option, or has been a good option, particularly in younger patients, which you would expect would have better tissue. And that's proven to be pretty good so far over the 3.5 years we've been doing it.
Now, Dr. Seth Manis of the Cardinals is going to be the pioneer in this surgery. He'll be going in spring training. He's thrown a lot quicker than if he'd had normal Tommy John surgery. What are you looking for from Seth Manis? What do you have to see to know that this surgery is going to take a step forward and go in the right direction?
Well, I didn't treat Seth, and I've never met him, but George Paletta, who's the guy who did the surgery, is a very skilled elbow surgeon and has been doing this for a long time, and George and I talked about it before his surgery, and I think that what really needs to happen is the sun needs to come up a few more hundred times for us to know the answer to that. It's been great in high school and college kids with the right problem, and the results have been great, and we've seen that, over the initial part of this, but we've been very cautious to say that we can't look at this through rose-colored glasses as the next Tommy John thing. It's definitely not for every patient, and Seth took the step to do this. We knew sooner or later there'd be a major league guy that would fit this, and kudos to George and Seth for making the decision to do that. We're all watching. I'm watching. I'm just as anxious as everybody else to see how Seth does with this. And, like I said, a couple hundred more days coming up, and we'll know the answer.
Doctor, does this mean that now that you could have any number of elbow surgeries if you're able to use the native ligament and just keep re-sewing it? Does this mean you could have 2, 3 of these procedures and still throw it at a major league level?
I don't think so. I think that would be a stretch because if it tore, multiple times, you probably wouldn't be dealing with good tissue at that point.
Okay.
And you'd probably, I'm a fan of saying if option A doesn't work, option A probably isn't a good idea for the second round,
Right.
You probably need to go to a different operation. And knock on wood, we haven't had to go that route. And I think that's because we've been very selective about which patients to do this on.
Doctor, what do you think about the epidemic of these types of surgeries, or this need for the type of surgeries, the Tommy John surgeries, all the elbow issues? Why is that? Why has there been such an epidemic?
Well, it's been sport specialization at younger and younger ages. It's been, more understanding of how to throw a ball harder. It's been year-round baseball and year-round throwing, and the radar guns, and then there's a whole slew of things that play into that. It's a cultural thing as much as it is anything. But what I don't think it is coaches making the decision to abuse kids. I've yet to run into a coach that tells a kid that's hurt to go play. Those are few and far between. I think it's more just the nature of the baseball world that we live in now, with youth baseball being such a year-round and higher-level sport than it used to. We didn't have travel ball when I was a kid.
You referenced that the younger patients, usually the tissue's in much better shape. How young a patient have you done this procedure on?
The youngest I've done is 13.
Okay. I mean, you hear all the the time about high school kids getting Tommy John surgery, and some kids getting Tommy John surgery before the ligament actually snaps, almost as a preventive measure, and that always seems somewhat insane to me.
Yeah, I'm not a fan of preventative surgery. What we see, and this is one of Dr. Andrews' favorite isms, is the younger they are, the less is wrong with them, and the more they want to have an operation to fix it. And there's some truth to that. We see, this has been a good operation for partial tears that people can't seem to get over. If you MRI every major league elbow, you're going to see some abnormalities in a lot of these guys that can go out there and sling it for an entire season and never have a problem. And you got to remember that comparing somebody like that is at the absolute tip of the iceberg as an athlete standpoint and understands how to mechanically get the most out of their body is not the same as comparing them to a high school kid or a junior high school kid or even a college kid. These are the best of the best, and they can make it work, and they've made it work over time. These high school kids, they're on a shorter leash in terms of time. They have less opportunity, because there's just not as many of them. The seasons are shorter, they get time crunched. And so when you're dealing with a lower level of pathology, smaller tears and things like that, maybe this is a good option for those kids. And that's really was the genesis of this, was to maybe give an option for some of the lesser pathology that we see. We've cut into a bunch of these ligaments and thought, this isn't like the major league guy that the elbows, the ligaments disastrously, diseased, and it's been beat on for years, and, that's a different kind of issue that you're dealing with.
Dr. Dugas, thanks so much for joining us today. We appreciate your time.
My pleasure. Thanks for having me.
Dr. Jeffrey Dugas, orthopedic surgeon, sports medicine specialist from the Andrews Sports Medicine Clinic in Birmingham, Alabama, and now you avoided elbow surgery and shoulder surgery. You had some knee surgery along the way, but Tommy John surgery happened during your career, and at the time it happened to Tommy John, it was almost like a voodoo. It seemed like something almost from science fiction.
Yes, it did, and you're talking about transplanting a ligament from. Some guys have had them taken out of their lower legs. Some guys have had them taken out of their sides. But you're actually taking a ligament, and the doctor called it, I guess it's not a native ligament, so that it has to be transplanted into the elbow. But I was thinking after I asked my question that, it's possible because I guess once you've done this and the tissue's still good enough to where we don't have to go bring in do a transplant, a ligament transplant, that there'll be guys that will have one of each, possibly a whatever they call this procedure, and they will have a Tommy John also later on because maybe their tissue is not good enough to where they can use the native ligament, and they have to do a transplant.
It's interesting how rehabilitation started at 18 months when they first started Tommy John surgery in 1974. Then it's down to 12, and now with Seth Manis, it's 7.5 months. He's already throwing. He's going to be ready. 7.5 months. It is an amazing medical procedure, and the fact that usually after Tommy John surgery, a pitcher can't throw for 10 weeks. Manis is throwing for 5 weeks. My question is Tommy John, part of history now? Are we going to be saying when that player has an injury, oh my gosh, he needs Seth Manis? You remember when we talked about Tommy John?
Well, I wonder if they will name it Seth Manis now.
Well, they will. Seth Manis is the guinea pig for that.
Yeah.
Now,
he's the Tommy John of this decade.
Well, that's right. But when Tommy John had his surgery, it was a flip a coin whether or not it was going to work or not. Now, obviously, in his case, he pitched another 14 years.
Yeah, it worked
46 years old.
There was only one guy doing it. It wasn't like there were bone cutters all over the country that were doing. I think he went to the Job curling clinic, and they were the only. He was the guinea pig. He was the Seth Manis of his day. They didn't know how that would come out, and obviously Tommy was a great guy to do it the first time on because, like you said, he got 14 more years after he had a ligament transplant.
Well, all eyes will be on Seth Manis this year with the St. Louis Cardinals to see if this thing works, to see if there will be a second try from somebody else.